In this video, I'm going to describe Intac surgery. An Intac is a curved piece of plastic placed into the cornea, which is the clear window in the front of the eye, to help stabilize and smooth the shape of the cornea. Intacs are used to treat keratoconus, which is a progressive steepening or thinning of the cornea, or ECTASIA, which is a LASIK-induced steepening or thinning of the cornea, very similar to keratoconus. This surgery is elective and is currently not FDA approved. While Intac surgery is approved for use in most countries in the world, we perform treatment under an FDA investigational device exemption here in our practice. The purpose of an Intac is to diminish and centralize the steepening of the cornea to make it more regular and to avoid cornea transplantation. Typically, this regularization of the cornea also makes it easier to fit a contact lens, both a soft lens and/or a hard lens. There is some evidence that Intacs may possibly stabilize the cornea from changing shape, but the shape may continue to change despite the Intac. Another experimental treatment called cross-linking is available to try to stop progression of your keratoconus if your cornea continues to steepen despite the Intac. Cross-linking involves placing a substance on the cornea called riboflavin and shining an ultraviolet light in order to link the collagen fibrils in the cornea. While your vision with and without glasses or contacts may improve with an Intac, you will still likely require glasses, soft or hard contacts to maximize your vision after surgery. You may also be a candidate for further vision correction with PRK or a toric ICL or IOL after the Intac placement to decrease your dependence on glasses and contacts. You would need to wait a minimum of 6 months after the Intac to have additional vision correction surgery. Intac surgery takes about 15 minutes per eye and is done under eye drop anesthesia, meaning no needles. You will be giving a relaxing medication in the form of a pill or through an IV. During the treatment, you may experience mild pressure, but no pain. Intac surgery is performed by placing a suction ring on the eye, and channels are created at 2/3 depth. During creation of these channels, your vision will black out. Next, either 1 or 2 plastic Intac ring segments are placed into the channels in order to stretch the cornea. A single stitch is placed in the opening, and this stitch is removed at 2 to 4 weeks following the procedure. In the first few days after surgery, the vision will be blurry and you'll see colors. You may experience burning, stinging, and irritation in the eyes for the first 24 to 48 hours. It's normal for the vision to remain blurry for a few days or weeks after the Intac implant, depending on how much swelling you have. As I mentioned, don't expect to have good vision without glasses or contact lenses following an Intac. You can be fit for new glasses or contacts within a few weeks after the procedure. You'll follow up the next day and then usually a week or 2 later with us or at your optometrist's office. You'll be using an antibiotic, steroid, and non-steroidal drop in the eyes for a few weeks. The risks with Intacs are low and typically treatable. The more serious but less common risks of an Intac include infection or erosion of the Intac if it is placed too shallow in the cornea. The less serious but more common risks include the fact that some people get no effect from the Intac, people occasionally get inflammation around the segment, and some patients may become light sensitive that tends to diminish with time. In summary, the Intac procedure is an experimental technique that is used to try and avoid cornea transplantation in patients with keratoconus or ectasia. Intacs tend to be highly effective in improving vision in keratoconus or ectasia, but always requires glasses, contact lenses, or additional vision correction surgery to see well after the procedure.